Hi, I'm Dr. Michael Morris at Facial Cosmetic Surgeon. I'm here today with Dr. Saj Jivraj, a prosthodontist. Saj, I have a question for you. Last week I had a patient come to my office, a young lady who was beautiful face, beautiful smile, but she was really embarrassed about her teeth. She had a lot of cracked teeth. There were some broken teeth. There was some color discoloration problems with some of the teeth. They didn't match colors. And I was wondering what you would do in a case like this. I'm not sure if she's a candidate for crowns or veneers. When I see a patient like this, and as I just described, what comes to your mind as far as treatment options for her, whether it be crowns or veneers, and how would you take this case on? Because this patient is otherwise a beautiful young lady, but she's just really unhappy with her teeth and she's afraid to smile.
That's a great question, Mike. And due to the aging process, teeth wear, teeth discolor, and patients lose enamel, so you get the yellowness of the understructure of the tooth showing through. And most patients that I see do come to us with some cosmetic desires. Now, you asked a very important question: what would I do, crowns or veneers? So I think it's quite pertinent if I quickly describe the difference between the two. So a crown essentially is filing the whole tooth down into a tiny little nub, which in my opinion may be a little bit too aggressive to do. On the flip side, we have something called veneers, and veneers are done very differently today than we used to do them. The way we try to do veneers is we try to add volume to the tooth. What that means is we try to maintain as much of the patient's tooth structure as possible. And by adding volume, we can improve the shape, we can improve the length, we can improve the texture, we can improve the arrangement of the teeth, and we can even improve the display of the teeth. Now, the big difference between a crown and a veneer will last you much longer. There'll be less repercussions on the tooth overall because we're really not cutting into the tooth. Now, as a prosthodontist, my job usually involves, cutting into teeth. But whenever I don't have to cut into teeth, and whenever I can be as conservative as possible, and whenever I can be as minimally invasive as possible, it really helps the patient long term. So I'm not just thinking about the cosmetic side of things and enhancing the appearance, but I'm also thinking about the biological health of the tooth, because the less I do for the patient, the better it will be. And we find that veneers really enhance their smile. We can get the same color. We can, as I said, improve the appearance, improve the arrangement, and they last a good 15-20 years. So veneers, in my opinion, would probably be the way to go.